Yes, I was very, very pleased with the outcome. For a long, long time, I tried on my own to have community treatment orders like withdrawn or dismissed, and I couldn't do it on my own. And it's just really wonderful that Dr. Lucia came in and immediately did the gene test, which proved that all those medications that have been prescribed in the past for me were just not the right things. The first thing that should be done before anybody is prescribed anything is now the gene test, and that determines whether or not you're going to have a poor reaction to what is being prescribed. And that could have been done for me 9 years ago, and not any one of these doctors said, let's try this gene test. My sister's extremely pleased, Margaret, because she'd gone to the tribunals a couple of times before and she was ignored, and she was questioned about did she know more than the professionals, and she does actually, because she's my sister and been my sister all her life.
She knows you.
Well, it's a terrible stigma to be considered mentally ill when you know that you're not mentally ill, but you become caught in the system, and then you are. That's how you're classified. To have that label on you, it affects many friendships and relationships, and it's very difficult to get out from under it.
Do you want to tell us about maybe some of your worst experiences that you've had?
The worst ones would be when they've withdrawn me from my home. There's been 2 occasions where they mental health personnel have phoned the police and said I was suicidal, which was totally untrue. So they've had the police and ambulance call at my home and drag me out and handcuff me like a criminal, and then place me in the mental hospital. There's no way I'm going to even think about taking my own life, because I've got a life to live and there mightn't be much of it left now. Then just 5 years ago, I was medicated, and I kept telling the treater that it wasn't right for me. I couldn't sleep and I couldn't sit down on a chair. And then I was injected with another medication which put me in a coma. And they called in 2 of my children and told them that I mightn't come out of the coma alive, or if I came out I might be brain damaged. I was then transferred to the General Hospital, and a toxicologist took over from the psychiatric hospital, and I was in there for 2 months. I wasn't actually capable of looking after myself. I had to have Meals on Wheels delivered and home care, and in all it took 4 months to recover from. No, they didn't know. There was not even an apology for that. Dr. Lucia, she has given me a list of medications that should never be prescribed for me, even such things as paracetamol. None of these prescribers could agree on a condition that I had, and they were actually prescribing for something that I didn't have. My first child was born under anaesthetic, and I came out of the anaesthetic in a very poor state, she was being adopted into another family, and there was a lot of grief about that. It took me to the local hospital where they just immediately put me in the psychiatric ward and began medicating me, and continual doses of a drug called stelazine, and then every 2 weeks it was an injection of what they then called Motocaine, which is an antipsychotic preparation, and they kept me there for 7 months. Totally unmotivated to do anything. There was very little hope of anything, and then eventually I decided I just must get out of here. I had a very, very difficult marriage, so I had the first community treatment order that was placed on me was in 1979. My husband thoroughly agreed with that happening, and so over the period of the time that we were married, he was able to place me in psychiatric hospitals and have me medicated. It was very difficult to come on release, to come back and pick up again, because all everything had just been turned extremely chaotic for me. After you come out of a hospital, you need to really re-establish yourself again, and everything was thrust on me again in a big heap, and so it was quite difficult to start off again. I've actually lost count now. I've lost count of how many times, yeah. I've been able to do for volunteer work, and I'm presently a scripture teacher in one of the local schools, and over the years I've done a variety of things that I think have helped in the community. And that hasn't been difficult for me. The home scene was very difficult for many, many years, yeah. And then mental health coming in compounded difficulties. I've always had faith. I've always believed that no matter how down I've been gone, well, I can come back up again. And as Dr. Lucia said, we need very few psychiatrists because there's very little mental illness. It's just something that is placed on somebody because somebody else believes that you're a bit crazy. We all have emotions, and all that medications do is turn you into a bland, non-productive person unless you've got the fight to still keep bouncing back.
A bit more about those experiences?
Yes, I've seen too many people who they just had their life put on hold because of community treatment orders.